Hello, everyone. It's Phil Jacobus. It's November 4th. I'm here at my office in New York City. It's the day after Election Day, and we still don't know who the new president is going to be. That's sort of a bummer. Uh, let's hope things go smoothly and that we can come back together as a country. Uh, Today, I'm going to be joined by Mr. Stuart Long, who is an innovator and a disruptor of the market. I think you'll find that to be an interesting interview. He'll talk about cardiac monitoring or arrhythmia monitoring. I want to make sure I get it right. But first, let's take a look at some of the stories that are in today's news. You see here a study that was done suggesting that Groupon may not be the safest bet when it comes to ordering up diagnostic imaging. What a surprise that is. I can't imagine that anybody is looking for the cheapest medical service. There's a story about Medicare cuts on the horizon, and also a story about how health insurance, new rules are requiring health insurance plans to disclose pricing for medical services. Healthcare is front and center in terms of what's on everyone's mind, and those of us in the industry, we're all doing our part. Okay, everyone, as promised, today I'm joined by Stuart Long, who's the CEO of InfoBionic. Stuart, thank you for joining us.
It's a pleasure to be here. Thanks for having me.
And Stuart wrote a very interesting and not only interesting, but fun piece in our April issue, talking about the history of cardiac monitoring. We'll put a link in the story. It's for those of you who've been in the business for a while, you'll enjoy the piece because it talks about how the industry has evolved. Now, Stuart, forgive me, but for those of our viewers who are not familiar, and InfoBionic is a digital health company that's focused on ambulatory and remote patient cardiac arrhythmia monitoring, right, and processes, and to help patients and physicians both. But tell us just a little bit about, and forgive me, I'm going to turn off my instant messenger. Tell us a little bit about InfoBionic for those of us who are not familiar with the company as I am.
Yeah, happy to. And thanks again for the opportunity. So InfoBionic is, as you mentioned, we're a company that specializes in monitoring remotely for the detection and diagnosis of arrhythmia. And we've been in business now going on our 5th year. And we have come to the market at a pretty interesting time where we've brought what we think is a lot of innovation and also some disruption relative to how the businesses are performed, right? So I think, what we've tried to do, and I use an analogy, I try to liken, floppy disks and fax machines, the way kind of healthcare has run for a long time, especially in some aspects of remote care, and compare that to Dropbox. And so we kind of liken ourselves to the Dropbox element in that we've tried to innovate by bringing a cloud-based solution where we acquire, data, cardiac arrhythmia data from the body. We stream that to the cloud. We use the power of the cloud to assess that information and then make our recommendations for interpretation. But more importantly, we're able to stream that to any authorized user for them to look at that while the study's in progress. And so what it does is we call that streaming full disclosure. Every 100% of the heartbeats 100% of the time. And we use a host of artificial intelligence tools to kind of coalesce that information and make it very digestible in a meaningful way for clinicians who want to review that rapidly. But more importantly, what that does is that helps speed time to diagnosis, which has a more important effect, and that allows patients to get their intervention or their treatment much quicker than they might normally through the normal courses and channels. And then I mentioned a little bit about disruption. So one of the things where we've differentiated ourselves in the market is that we're a shop that insources this. And what I mean by that is typically there are 3 tests that are done in this vertical, or 4, I should say. It's the 2-day Holter monitor, which a lot of folks are familiar with. It's a monitor that's worn for 1 or 2 days. Has a very high rate, 80–85% of being non-diagnostic. So therefore, you're typically going to do another kind of test to try to find something. And that can be an extended Holter. That's a different device with different companies mostly, and that can go all the way up to 14 days. And then you can get into either higher complexity or higher diagnostic yield with what's called event monitoring, which is where patients would push a button. It's mostly self-diagnostic. And then the gold standard called mobile cardiac telemetry, which is where you're doing a greater detail report. You're using different devices to look more deep at the heart, and you're interacting daily with clinicians relative to the information. And so that's really kind of the industry and kind of what we cover in those tests. But where we differentiate is we are not a third-party service provider. What we do is we sell our devices to providers, hospitals, or physician practices. And what they're able to do is then own the device and then perform that service. And by that virtue, and very differently, what they normally do is they're able to bill either globally or for the technical component of that. And so that offers a good advantage relative to owning the devices, much like you would own your CAT scan machine or your treadmills or your ECG machines for your offices. You're able to perform the function as you're billing like that, rather than outsource it and only bill for the professional component. So that's kind of what we do and why we're different. And we've been able to make some headway into the market that we're pretty proud of. And I think probably more importantly, the most important thing we do is shorten the time to diagnosis in a really high quality way.
So 2 questions I have. You mentioned there are 4 categories or 4 different pieces of information, the Holter monitor, the 2-week, the instant, and telemetry. Do you do all of this at the same time simultaneously, or is your equipment used in different ways?
Yeah, it's a great question. So none of those tests are done simultaneously. Typically, they're done either linear, and that might be the 2-day Holter, where you're looking for something, you don't find it, and then you're able to move on to, say, an event test or an MCT, depending on what the medical necessity calls for. Oftentimes you could go directly to some of those tests without doing the 2-day test. You could do the up to 14-day test or some of the other tests as well. But all of those tests are done independently. Our device, though, and those are typically different devices for each one of those tests. Where we differentiate is our device actually does all of those tests, whether you order it, say for instance remotely, you want to do the medical policy requires you do a 2-day Holter test first, see if you find anything, and if it's negative, then you can switch over and then do a longer term monitoring test. And in our world, that means that you would do the test on the 2-day test, you would find that it was negative, you would complete that test and then switch it over to a longer term monitoring mode remotely, without having to bring the patient back to the office, get a new device, and therefore obviously inducing more delays. And so we're able to do that on the fly within the software. Both the tech staff that has to manage that is a big improvement in their lives, because they're not having to manage and switch out multiple devices in the practices.
Yeah, and in a COVID world, I suppose it's good news for the patient and for the technician that the patient doesn't have to come back to the hospital to switch out the device.
You're exactly right. And COVID is a really good example of, we were born and built to monitor remotely and monitor in the home specifically. And it really brought to roost the importance of being able to care for patients remotely, whether that's just cardiac monitoring or any kind of remote monitoring or telehealth capacity. And so we've been able to thrive within COVID.
Does the patient connect the device themselves, or do they need the technician to do that?
So in a normal routine for us, where we differentiate, normally the doctor is going to have you come to their office. They'll say, okay, we think you might have a problem. We're going to send you home, and a third party company will call you and they'll send you the device, and the patient will hook themselves up. In a non-COVID world or pandemic world, what we do is the patient comes to the office. The doctor says, we're going to put a device on you. Stay right here. Technician or the nurse will be in a few moments. We'll put that on you. And before they leave, they're able to see that data coming off the patient on an iPad or any mobile device or computer. So that's one big difference. And so from that virtue, we are almost technically 100% compliant. And that's a big issue that we solve for, because it's sometimes patients have a difficulty trying to understand how to put the device on. Sometimes they're not really motivated to do it. They may not put it on for some period of time.
Yes.
But in COVID, we had to adapt, right? And I think a lot of the vendors had to really pay attention. Anybody in this space that's doing remote care, on either how to connect with the patient in the home, whether that's telephonically or over video, and then get the medical devices to the patients so that they could put them on themselves, monitor, and get them back. And patients that had to quarantine, you're not able to take your device and drop it off at your local UPS station. So we really had to think long and hard about how to do that really efficiently, and we've been able to do that. And I think that was a pretty smart pivot that we made in COVID, because there was a study done. Where did all the heart attacks go? Patients just stopped going to their physicians' offices. And one advantage with our device, number one, is just the clinical value you get from continuing to monitor your patients, and we can talk about some of the impacts that COVID has on the heart. But at the same time, you're able to continue to do that, and then you're also, by the virtue of owning your devices and managing and doing the work for that, you're able to then bill for the technical component, which on some of these tests is can be sizable. So there's an advantage across the board, both clinically, as well as having the advantage from ownership and being able to continue to do maintain your business even if your office is closed.
So how long have you been, if I understand correctly, prior to your company, the devices were owned by the companies that manufactured them, and the data that they retrieved and shared with the doctor. But in your situation, the devices are owned by the doctors or the hospitals, and the data is kept in the cloud somewhere, and they have access to it through their computer or iPad. Is that correct?
Yeah, for the most part, that's correct. Yeah, they're, I think, prior to our entry into the market, the Holter monitor, the 2-day test, that's been around the longest, and it got to a point where the reimbursement for the 2-day test is pretty low, so physicians would purchase those monitors. So a lot of doctors have Holter monitors in their offices versus outsourcing that. But the longer you get into testing, and then the logistics of getting devices in and out to patients' homes, doctors weren't up for that task because it was pretty complex, and so they have not owned those devices and relied on that third party, and then they get a result which is literally less than 1% of the total data that gets acquired during that study period. And for the most part, with the exception of the MCTs, you don't have access to the information during the test period. So there's substantial delays, upwards of, can be up to 4 weeks from the time the service starts before you actually get your results. And a lot can happen to a patient in 4 weeks. Whereas in our model, they own those devices, and we've developed it in such a way that the workflow and the process is extremely efficient. So there's not a real burden by taking on this work, and the trade-off is the doctors just love having control of their.
Is the market embracing this idea of owning it themselves?
They are. We've had phenomenal success. Coming into the market, we're having a lot of success during COVID. We've been able to secure a couple very large scale customers in the market. One is the largest independent cardiology practice in the U.S. Another one is one of the largest health systems in the world. And they chose us in the middle of the pandemic, and primarily for the technical superiority that the product brings. And that is both just in the quality of the signal that you get, but the idea that we like to say we replicate, or it's similar to in-hospital telemetry, in that you're getting literally all of the heartbeats streaming by. So in the world of COVID, there's all sorts of challenges, with conditions with, patients with pre-existing heart conditions. There's, conditions that are introduced as a result of COVID. There's complications from lungs that are on the heart that introduce things. So whether you're looking to titrate medications, look for arrhythmia changes, or simply manage your patient's heart disease, our ability to give physicians information that they're not able to get anywhere else in a remote care setting, that is nearly equivalent to the quality of the signal that you get in a hospital, has been I think a real eye opener for the industry. So we're really pleased with kind of our progress pre-pandemic, and then what we've been able to accomplish during the pandemic.
Are there data security or privacy concerns that?
Yes, and I think I think this is something that every vendor has to take very seriously, right? And even patients, right, in terms of how they treat the devices and how they manage their data. We're hosted in Amazon Web Services, the Amazon Cloud. We use some of the world's leading security intermediaries to ensure that we comply to all of the the highest level of security, high trust, SOC 2, government level level type security. But it also goes down to how data is transmitted from the acquisition device to the cloud, how it's delivered back to acquisition devices, ensuring there's end-to-end encryption, making sure that we have appropriate measures relative to HIPAA and password policies for our end users, because there's always the human error element in terms of managing at the point of care. So we pay a lot of attention to that, and I think all the vendors are doing that because there's higher risk, I think, than there used to be, because there's just more things online with the Internet of Things, right? When you're trying to maybe integrate an SpO2 monitor that you got at the pharmacy along with your Fitbit scale, you want to try to send that information along with our ECG information. You've got wildly different security protocols that have to be taken into account. So we're very much focused on security, and we feel very confident and comfortable in what our product's able to do, primarily because we own the I'll call it the supply chain on your medical data end to end, kind of like the Apple model, right? Where it's our device, we manufacture it, we acquire that data, it goes through our pipe to the cloud, it lives within our application, and you can only access it through our application, albeit on any mobile device. But again, that's all done via zero footprint browsers, and the security there is pretty good as well. So we're pretty confident about the security of the device.
Well, it sounds like a very it sounds like your company is innovative, and you came up with a good idea and turns out at the right time. I suppose there isn't a bad time to do this, but this is a particularly good time. And I want to thank you for joining us today. It's very interesting what your company does, and I hope you'll check back with us in a year or so and let us know how things are going.
I would be happy to do that. And thanks again for the invitation. I appreciate it.
And thank you very much.